We begin this morning with that ruling by a federal judge in Florida. The decision overturns the Biden administration's mask mandate on planes, trains, and other forms of public transportation. Now, the judge said the CDC exceeded its authority by issuing a public health measure requiring masks. Soon after, the White House announced that the TSA would stop enforcing the measure. The major airlines followed suit. The ruling comes just days after the Biden administration had actually extended the mandate by 15 days into early May as COVID cases once again begin to creep up across the country. We have full team coverage of the ruling. Dr. Amy Shadalja is here for more on what this means for Americans going forward. And NBC News medical reporter Erica Edwards has the latest from the World Vaccine Congress in Washington. But we begin with NBC News correspondent Antonia Hilton, who's live for us from JFK Airport here in New York. Antonia, good morning to you. So let's start with the judge's ruling. What was the reasoning behind her decision, and what are you hearing from travelers so far?
Good morning, Joe. This judge in Florida struck down the CDC's mask mandate, calling it unlawful and basically arguing that the CDC had extended or gone outside of its own authority. And the administration, the CDC, had announced an extension of this mask mandate in response to the spread of Omicron subvariant 2 as an effort to tackle the spread, to minimize the spread in cities like New York City for the next couple weeks. What we're seeing now here in terms of response is it's about 50-50. Some passengers still committed right now to wearing masks, seeming like that's what's most comfortable for travel right now. And then others who were excited to rip their masks off. You know, we have colleagues who took a flight this morning and were describing seeing people still wearing masks on a Delta flight from D.C. over to Atlanta. And, you know, I think what we're going to see right now, especially in cities like New York, where people have been pretty committed and comfortable with mask wearing, is a slow transition over the next couple days. And there are certainly some travelers who have continued to say that, you know, masks for them are important for family members who are immunocompromised, for, you know, health and safety reasons, as they're fearful of catching the Omicron variant over the next couple weeks. But there's certainly going to be this adjustment period because people have been wearing these masks on planes for the last 2 years, Joe.
So, Antonia, I mean, we know many of the major airlines quickly dropped the requirement that passengers wear masks. They've been pushing for this mandate to go away recently. What has been the reaction from the airline industry in general? And what about other mass transit operators? I understand some of them are still going to keep the mask mandate in effect.
That's right. In terms of the airline industry, you know, for weeks, many of the airline industry leaders have been signaling that they wanted this mask mandate to come to an end. In fact, the CEO of Delta has long been publicly arguing that an end to the mask mandate on flights was a critical part of returning to normalcy, of getting the airline industry back entirely and up on its feet. And so for much of the airline industry, this was welcome news. There were reports that last night, you know, pilots were going out over their PA systems and cheering, declaring that passengers should be happy, they can take their masks off. But as you mentioned, that is not the case across the rest of the public transit system, particularly if you live in the New York area. Here in New York, the MTA is still going to require masks, at least at this time. New Jersey Transit was also initially going to require masks, but they recently have decided that they will not be. And so it's a little bit of a patchwork system now, but on flights, TSA is no longer enforcing the mask mandate, but throughout much of the New York system, you'll still see masks being required for passengers, Joe.
And Antonia, what is the Biden administration saying about this ruling? Do we expect them to appeal it?
You know, we don't know yet if they're going to appeal. What the Biden administration has said is that, frankly, they are disappointed with this decision and that they're reviewing their options. They're reviewing the decision and what steps they might be able to take going forward. And, you know, look, I think the plan was right, again, for this to be extended through May 3rd. But people initially thought that April 18th was going to be the end here. So, you know, you should actually take a listen to what Jen Psaki stated last night. She puts the administration's view on this and sort of evaluation for their next steps forward in her own terms. Take a listen.
This is obviously a disappointing decision. The CDC continues recommending wearing a mask in public transit. As you know, this just came out this afternoon. So right now, the Department of Homeland Security, who would be implementing, and the CDC are reviewing the decision. And of course, the Department of Justice would make any determinations about litigation.
while the administration has to evaluate its next steps, passengers are really going to be making their own choices now. This is really going to be about personal responsibility, which has been a message from many parts of the public transit system and from public health authorities around New York, Connecticut, and New Jersey in the last several weeks. And that's what we expect to see happen now, that passengers will have to decide for themselves what steps make them most comfortable for the health and safety of themselves and the people around them. Joe?
Which is where this is heading in so many arenas. All right, Antonia Hilton, thank you so much. Now, this morning in Washington, vaccine experts from around the world are gathering to discuss what's working and what isn't in the battle against COVID-19. NBC News medical reporter Erica Edwards joins us now with more on that. So, Erica, this is the first in-person meeting for the World Vaccine Congress since the pandemic began. So much has changed about our understanding of vaccines, how they interact with COVID. What is the latest thinking on how long immunity lasts, both for people who are vaccinated and for those who've actually been infected with COVID in the past?
That certainly is a key question for the vaccine experts gathered here at the World Vaccine Congress, which is about to kick off in about an hour or so here in Washington. Right now, it seems that protection either from vaccination or from infection lasts about 6 months before it starts to wane, even sooner if you have a weakened immune system. But, you know, giving boosters every 6 months is just not sustainable. One of the key questions that they will be talking about here at the conference is how to build a longer lasting, more durable vaccine. Joe?
So, Erica, what are experts saying about a possible long-term vaccine against COVID? Is there any agreement at all on when we might need the next booster, how those boosters are going to play out?
Right. You know, as effective as these mRNA vaccines are, they just don't last as long as doctors had hoped they would. Right now, there is work ongoing. In fact, there's more than 150 vaccine candidates in some stage of study or development worldwide, if you can believe that. As far as the boosters go, they do anticipate that we might need another one this fall, especially as the weather cools and as cases of that BA2 subvariant continue to rise. Joe?
All right. Erica Edwards in Washington. Erica, thank you so much. Let's bring in Dr. Amish Adalja for more on the latest COVID headlines. He's a senior scholar at Johns Hopkins Center for Health Security. I think a lot of people want to hear from you right now, Doctor. They may have some questions now with this mask mandate on transportation now going away. The CDC had extended it because of the rise in cases. So what is the risk for passengers now when they travel? Do you think now is a good time to be removing masks on public transportation?
We've always needed off-ramps for these government requirements for masks on public transit. And what we're talking about is a difference probably of 2 weeks of when the Biden administration had set this to expire versus what the judge decided. But I think the important point to remember is, yes, masks work, but not everybody has the same risk preferences. And I think if you're someone that's fully vaccinated and healthy, COVID-19 is more of a nuisance infection to you. If you're somebody that's high risk, you can continue to wear a mask in those high risk situations, which might include being on a bus or on a subway. And one-way masking works. When we're talking about airplanes, I think it's one of the lower risk things people do because of the number of air the number of air cycles that occur, how much the air is recycled, the filtration. So I don't think it really made sense to require masks on airplanes, but not on everything else, which is much more high risk, for example, eating at bars. So I'm not so surprised about this. I'm not so worried about this because we're at a point now where I think individuals have to learn how to make risk calculations, and I think this is a good time to start.
So the CDC made a travel decision that might have gone under the radar. The agency removed all countries from the highest COVID travel risk category, which is Category 4, reserving that for special circumstances only. So do these travel advisory lists make a difference? Should we be checking these lists before we travel internationally?
Not so much. And I think it's kind of a folly to think that when you travel internationally, you have a higher risk of COVID than you do here in the United States. We know that COVID-19 is still circulating pretty heavily in the United States. There's tens of thousands of cases occurring every day. And I don't think that's much different in other countries. So I don't think looking for hotspots on the international list at this point makes sense. If something goes out of control, if something is different, that may change. But right now, I think your risk, domestic travel versus international travel is very similar. So I don't think that there's much benefit from a COVID perspective to looking to see where the high risk spots are, because you can just assume that it's circulating everywhere. This is an endemic respiratory virus.
Big picture, Dr. Adalja, how do we make sense of all these changing guidelines right now? And what are the precautions we should be taking before we leave as well as when we're traveling?
A lot of this is going to boil down to individual risk tolerance and what your risk factors are for severe disease. We've really been stunted in this country because we kind of took an abstinence-only approach where people were told, never do this activity, and didn't really generate the ability of the population to learn how to risk calculate, to learn how to decide what's high risk, what's low risk, and how to navigate a world in which COVID-19 is ever present. Now I think people have to start to be able to do that, just like they do with other respiratory viruses. And hopefully there'll be more guidance, and you can expect guidance to change because it's going to be different. It's not going to be one size fits all, but we are transitioning to a point where people have to learn to navigate a world in which there's always going to be some non-zero risk of COVID-19, but a risk that's really manageable because of all the medical countermeasures we have.
Dr. Amish Adalja, as always, appreciate your expertise. Thanks so much for joining us this morning. A new phase of the war in Ukraine is underway this morning. Ukraine now says Russia has launched an all-out ground attack in the eastern part of the country. Ukrainian President Volodymyr Zelensky says Russian forces are now fighting for the eastern part of the Donbas region along the Russian border. This new offensive follows a day of airstrikes across the country, including in the western city of Lviv, which has been relatively safe from attacks until now. At least 7 people were killed in Lviv yesterday. Nearly a dozen others were hurt, including a child. In a speech late yesterday, Ukraine's president told his people a large part of the Russian military is now focused on Donbas, but Ukraine will not stop fighting. NBC News global correspondent Raf Sanchez joins us now from Lviv. So, Raf, what do we know about this new phase of the war in the Donbas region, and how is Russia changing its strategy there?
So, Joe, you and I have been talking for literally weeks about Russia preparing for this all-out attack across the east. President Zelensky says that day has come. The Russians are attacking along a very, very long front, ranging from Kharkiv all the way up in the north, down through the Donbas, and ending in Mariupol in the south. Now, the Ukrainians say the Russians are throwing everything they have at this front, and an advisor to President Zelensky says they are under real pressure from Vladimir Putin to deliver something that he can call a victory for the Russian people. Take a listen.
It will be a really difficult battle for Ukrainian armed forces, but Ukrainian armed forces who are concentrated there, most of them have this experience of 8 years war in Donbas with Russia, because the open war started in 2022, but the Russian aggression started in 2014 when they captured parts of Donbas. So now this is the final battle for them. They have to make some symbolic victory.
Now, President Zelensky says this is a battle his forces can win, but only if they get the heavy weapons they need from the United States, from other NATO allies. Ukraine has been preparing for this fight for a long time. They have sent some of their absolute best troops to the Eastern Front, but this will be a different kind of battle from what we've seen around Kyiv. The Ukrainians very successful there, hit and run, guerrilla tactics. Joe, this is going to be more of a World War II style confrontation along a very long front, with tanks and artillery confronting each other in open areas. Jeff?
Raf, let's also talk about Lviv and the 4 missile strikes yesterday. You were at the scene of those strikes. What more do we know about these attacks, and why Russia is targeting Lviv in the west when their forces have really turned their focus to the east?
Yeah, Joe, so you can probably see behind me, things are actually pretty calm here right now. Folks are out and about on the streets. This time yesterday, the air raid sirens were blaring. A few hours before that, the missiles were raining down. We went to a car repair shop that was just over the railway lines that took a direct hit from one of those missiles. A number of people were killed there. Out of the 7 who were killed in total, 11 people were injured, including a child who was badly wounded. And this is Vladimir Putin reminding Ukrainians, reminding the world that nowhere in this country is out of range of his missiles. These wave of missiles, we now have a little more context for them. They were sort of the curtain going up on this offensive in the east. And I think it's a sign of Russia trying to do everything it can to cut off the Ukrainian railway lines, to try to stop Ukraine from moving the forces it needs, moving the equipment it needs from the west of the country, which is where NATO weapons are coming in, over to the east, where they will be needed for this new, very large-scale confrontation with Russian forces. Jeff?
Yeah, and Raf, let's go back to the east. Throughout eastern Ukraine, places like Mariupol, there is a huge humanitarian crisis going on. no food, no running water, other basic supplies running out. The United Nations says now it doesn't appear to be the time for a ceasefire to allow more aid into Ukraine. So how are people in the region getting aid? Is anything getting to them at all?
It doesn't look like it, Joe. The Russians have effectively sealed Mariupol off. They have the remaining Ukrainian troops in that city holed up in what's left of one of Europe's largest steel plants. There are concentric rings of Russian troops around them. But then the city itself, no one is coming in, no one is coming out without passing through Russian checkpoints. Ukraine's deputy prime minister says she has been desperately trying to get her Russian enemies to agree to a humanitarian corridor so women and children can come out of Mariupol, so food can come in. But the Russians are not agreeing to that at this point. The mayor of Mariupol says at least 10,000 people have been killed in that city so far. The infrastructure is in absolute ruins. As you were saying, there's almost no food. The World Food Program says people are on the brink of starvation. They've been reduced to drinking filthy water just to try to survive. And now we are looking at massive disruption all across the east of Ukraine. There are going to be a lot more cities directly in the sights of Vladimir Putin's forces, with more rockets, more artillery raining down on them. And one of the major challenges will be not only getting weapons and ammunition to the front lines to the soldiers, but also getting the humanitarian material we need to the east for the civilians. Joe?
Difficult situation that's only going to get harder as fighting intensifies in the eastern part of the country. Raph Sanchez, thanks so much for your reporting. Let's bring in Colonel Mark Kansian. He is the senior advisor for the International Security Program at the Center for Strategic and International Studies. Good to have you with us. So I want to start with this new offensive in the east. Ukrainian President Zelensky says it is underway, but in a report in the New York Times, analysts said an initial Russian bombardment may just be a prelude to an all-out onslaught. What does that mean? What do we expect to see now?
Well, this is likely the offensive we've been expecting for a couple of weeks. The Russians have been moving forces to the east. They gave up in the north and in the south, and have focused on this area where they've been fighting for the last 8 years. It's likely that this is the final phase of the war. Reports indicate that there's fighting along the entire front. If that's true, the Russians may be making the same operational mistake that they've made through the entire war, that is spreading their thin forces out too much. That would be good news for the Ukrainians, bad news for the Russians. One concern is that the Russians might be able to get behind the Ukrainians who are defending in the east at the where the fighting has been going on for the last 8 years. If the Russians can get behind the Ukrainians, that might push them out of their positions and force a retreat. The good news is that the focus on the east means that the Russians have narrowed their war aims. They're not trying to take over the whole country. Now they're trying to expand their holdings in the east.
I want to ask more specifically about Mariupol, which we were just talking about with Raph. It's been the scene of the war's heaviest fighting, at least right now. We know Ukrainian forces there, they say they're going to fight until the end. How much longer can they hold out? And what would losing that key port city mean?
Well, it's pretty clear that the valiant defense of Mariupol is coming to an end. The Ukrainian forces are being squeezed into smaller and smaller spaces. I think in the next couple of days, those forces will be overwhelmed. The good news is that by holding out for a month, the Ukrainians have caused a lot of Russian casualties and have delayed the Russian attacks in the east. The Russians have not been able to expand their position there. The bad news is that when Mariupol falls, the Russians will be able to free up some forces for the offensive up north and maybe be able to endanger the Ukrainians from the rear.
And there's been a lot of news made about the size of the latest U.S. military aid package, especially hundreds of anti-aircraft systems, thousands of anti-tank missiles and artillery rounds. Quickly on this last point, how quickly are those weapons getting used up?
Well, they're being used very rapidly, and as a result, this resupply is critical for the Ukrainian resistance. The United States has been supplying about $50 million a day of aid, and I think that will continue. That allows the Ukrainians to stay in the field, and it gives them an advantage because the Russians are not getting resupplied. They're using up their existing stocks. Something interesting in this new package is the provision of U.S. weapons, the artillery and the armored personnel carriers, but it will take many weeks for those to arrive on the front.
Colonel Mark Hansian, as always, thanks so much for joining us. We appreciate it. Members of the World Central Kitchen are vowing to stay in eastern Ukraine even after 4 staffers were hurt in a missile strike in Kharkiv over the weekend. The World Central Kitchen has been in Ukraine since the war began, helping supply meals to people in the country. On Saturday, 4 people were hospitalized with burns, some severe after the strike. World Central Kitchen founder Jose Andres says the staffers are recovering and that his team plans on getting back to work, helping the Ukrainians.
Everybody said we want to keep cooking. So the good news is that while the 4 wounded are getting better, they move whatever equipment was able to be safe, they move it to a new location. And if not tomorrow, the day after, those same teams of amazing, brave cooks, women and men are gonna start cooking again. This is the Ukrainian spirit.
The organization was created to help victims of humanitarian disasters, but this is the first time they've operated in a war zone and the first time one of its relief kitchens has come under attack. Let's get a check on your morning news now. Weather Bill Cairns is with us with hopefully a forecast that doesn't have snow in it.
Yeah, this has been a ridiculous snowstorm, John. I mean, we're seeing snowfall totals up to 16 inches in the Adirondacks, and it's not just at the highest elevations. All the way down through Binghamton, the Scranton, that southern tier of New York that I said I was concerned about was hit hard. Right now, we have 250,000 people without power. So 250,000 people without power. It's all because of this heavy snow, the early buds, the blooms, the early leaves on the trees. That's more surface area for the snow to stick to. And that is just taking trees down. So the power crews are going to have a lot of work ahead of them as the storm exits. And you can see we're not done yet. There's still a really impressive snow band right over the top of Syracuse to Binghamton this morning, and now about to rotate through Scranton area. Binghamton has 12 inches already on the ground, going to pick up another 1 to 2 inches from this, and then that band has to go back up through the Adirondacks. And Indian Lake in the Adirondacks has 16 inches of snow, and some of the snow even made it to the valley floors of the Hudson Valley and the Mohawk Valley. Areas around Schenectady picked up 5 inches of snow, so very historic for this time of year. Additional snowfall, not a lot left in Pennsylvania, southern New York, but in the Adirondacks, we still could see another 4 to 6 inches out of this. Vermont, maybe another 1 to 2. And it's going to stay pretty windy behind this storm. 19 million people are included in wind advisories and wind warnings. And it looks like the highest winds will be in areas coastal Maine, also out on Cape Cod, but still pretty breezy this afternoon behind the storm in New York, Philadelphia, and D.C. Minor airport delays are possible all the way back through Pittsburgh State College and in Buffalo. So for today's forecast, we'll say goodbye to our April snowstorm in New England. By the time we get through this evening, the roads should be all cleared up in most cases, especially with that sun angle and the sun coming back up. But Joe, we'll talk about what's next coming up in the next hour, and it has to warm up. I mean, it just has to.
Yeah, no kidding. All right. Well, we will look forward to that.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.